Instructions to the psychomotor skills candidate for long bone immobilization. This skill is designed to evaluate your ability to properly immobilize a closed, non-angulated, suspected long bone fracture. You are required to treat only the specific isolated injury. The scene survey and primary survey have been completed, and a suspected closed, non-angulated fracture of the left radius-ulna is discovered during the secondary survey. Continued assessment of the patient's airway, breathing, and central circulation is not necessary in this skill. You may use any equipment available in this room. You have 5 minutes to complete this skill. Do you have any questions?
No.
Long bone immobilization. The candidate takes or verbalizes appropriate body substance isolation precautions.
Seeing safety BSI.
The candidate then directs the application of manual stabilization of the injury.
I'm going to have my partner manually stabilize the injury.
The candidate assesses distal motor, sensory, and circulatory functions in the injured extremity.
Checking for a pulse. Feel pulse. Do you feel me touching you?
Yes.
Can you squeeze my fingers?
Yes.
The examiner will acknowledge motor, sensory, and circulatory functions are present and normal. The candidate then measures the splint. The candidate applies the splint.
Alright, I'm going to have you hold on to this gauze, and then if you can reach around to the edge of the board. Alright, I'm going to tuck this under your thumb.
The candidate immobilizes the joint above the injury site and the joint below the injury site. The candidate secures the entire injured extremity, immobilizing the hand in the position of function. The candidate reassesses distal motor, sensory, and circulatory functions in the injured extremity.
Checking for pulse. Feel pulse. Can you feel me touching you?
Yes.
Can you wiggle your fingers?
Yes.
The examiner acknowledges motor, sensory, and circulatory functions are present and normal.